Alright, hello my Anur BF class. Okay, so this is the second part of the microscopic urinalysis proper. Yes, as part of our discussion. And again, for this part, nasa organized sediments pa rin po tayo. So we are done with cells that originate from the blood or yung mga tinatawag nating cells of hematogenous origin, which in particular are your red blood cells and your white blood cells. So for this naman, we will start off with the cells which are present in our urine sample as part of desquamation. Okay? So katulad nga ng sinabi ko kanina, when we talk about desquamation, it might be as part of the normal physiologic process inside our body, particularly in our genitourinary tract, or it could also be due to an underlying condition which will facilitate, okay, more desquamation in that particular area of our body. Okay? So anong mga cells ang pwedeng present sa ating urine sample which are due or which is rather due to desquamation? So of course, we have our epithelial cells. Okay? So epithelial cells, there are three depending upon the origin. Okay? Kung saang part ba ng genitourinary tract galing yung cell na ito, kung saang epithelial lining siya galing. Okay? So what are the three epithelial cells which may be present in our urine sample? So first, we have your squamous epithelial cells. Okay, another, we have your transitional epithelial cells. And then lastly, we have our renal tubular epithelial cells. Okay, so nasa page 81 po yan ng ating module. Alright, so first, let us try to categorize them according to the frequency, okay, at which they are or they may be present in your urine sample and according to their significance. Okay, so in-arrange ko po siya from squamous, transitional, and then renal tubular. So squamous epithelial cell, they are considered to be the most frequently seen type of epithelial cell. Okay? So saan ang origin ng ating mga squamous epithelial cell? So particularly, they are found in the linings of the vagina, so for our female patients, and they are also found in the lower urethra. Okay, so lower urethra of both males and females, as well as the linings of the vagina of females, we have your squamous epithelial cells. So, okay, so kahit na most frequently seen ang squamous epithelial cells natin, when it comes to their significance, wala po silang significance. Okay, so they are not significant unless specified, okay, by the question in your exams, or unless deemed significant by the doctor or by the physician, okay, in clinical practice. Naku ha, ayan. So we have your squamous epithelial cells. So later, I will still elaborate on your squamous epithelial cells. Pero ngayon, yun nga, ang gagawin lang natin is sino ang laging nakikita, sino ang hindi masyadong nakikita, sino ang significant, sino ang hindi masyadong significant. Okay? So again, squamous epithelial cell, most frequently seen, but it is the least significant among the different epithelial cells. Alright? So next, we have your transitional epithelial cells. Your transitional epithelial cells, they may otherwise be referred to as your urothelial cells. Sige, lagay natin ha. Okay, so they are otherwise referred to as your urothelial cells, or they may also be referred to as your caudate cells. Okay? So ang sabi po sa ating Strasinger na book, your transitional cells, so it is the type of cell that is found in the urinary bladder as well as in the upper urethra. Okay? So ano yung ginamit nilang term in the recently concluded board exam? Ang ginamit po nilang term ay bladder cell. Okay? Syempre, syempre, nung narinig ko yung tanong na yun, na recall question sa board exam, talagang hinanap ko siya. Anong reference kaya ang gumamit ng term na bladder cell? Okay? Unfortunately, hindi ko po siya nakita sa mga references na meron ako. Hindi ko siya nakita sa Henry, hindi ko siya nakita sa Strasinger, hindi ko siya nakita sa McBride or sa Graph. Okay? So wala po yung term na bladder cell. However, yun nga, nabanggit ni Strasinger na transitional cell, okay, or transitional cells are cells of the urinary bladder. Okay, I have yet to check yung ibang references natin, yung mga old references natin like Moraleta or meron yung isa Baker yata. Hindi ko pa sila na-check, okay, kung ginamit ba nila exactly yung term na bladder cell. Pero yun nga, sinasabi ko, okay, sabi ni Strasinger, transitional cells are cells of the bladder or of the urinary bladder. So from that statement alone, masasabi natin na pag sinabi mong bladder cell, it actually refers to your transitional epithelial cell. Okay, so malay natin during your board exam, lumabas ulit yung tanong na yon, bladder cell. Okay, so yan. So later, i-elaborate ko pa yung bladder cell na yan. Alright, so from the term itself, transitional or your urothelial cell, okay? So ang ating transitional or ang ating urothelial cell, so it is the cell that lines, okay? That lines the epithelium of your renal pelvis. So, 'di ba, you have your two kidneys and then meron tayong continuous, 'di ba? Continuous na structure doon from your kidneys. We have your renal pelvis and then ureters, tama? Renal pelvis, ureters, and then urinary bladder, and then your urethra. Okay? So if you can still remember our physiology. All right? So mula sa calyces natin hanggang sa renal pelvis, hanggang sa ureters, hanggang sa urinary bladder, hanggang sa upper urethra, ang epithelium na nandyan ay tinatawag natin na transitional epithelium. Okay, your transitional epithelial cells are the ones that line this particular epithelium of our urinary tract. Okay? So again, your transitional epithelial cells are otherwise referred to as your urothelial or your caudate. Okay, so yan, nakita na natin kung saan nag-o-originate ang ating mga transitional epithelial cells. Ngayon, when it comes to the significance of your transitional epithelial cells, they are not significant in small numbers. Okay, however, they may be significant or they are significant if they are present in high numbers. Okay, yes, high numbers kasi normally naman na nagde-desquamate yung mga linings na yan. Tama? Normally lang naman. Normal naman yan. It's part of the physiologic or normal physiologic process of your epithelial or your epithelium changing itself. 'Di ba? We learned that in your histology na ang isang characteristic ng epithelium or ng epithelial tissue is that it constantly undergoes desquamation or exfoliation. Normal po 'yan. Kaya nga, if they are present in small numbers, wala po siyang significance. However, if they are present in high numbers, they are considered to be significant. Okay? So, pwedeng merong condition or there is a disease that is causing, okay, that is causing a faster exfoliation or desquamation of your epithelial lining. Okay, kaya present ang transitional sa high numbers. Okay, nakuha? Alright, and then next we have your renal tubular epithelial cells. So when it comes to the frequency at which we are able to see your renal tubular epithelial cells in your urine sample. Very hindi naman very, pero rare po siya. It is the least common. Okay? Most common or most frequently seen, squamous. Nasa gitna ang transitional. Okay? Least frequently seen, okay, or least common, we have your renal tubular epithelial cells. However, take note that their presence in your urine sample is considered to be significant. Okay? So out of the 3 epithelial cells which may be present in your urine sample, the most significant is your renal tubular epithelial cell. Bakit? This is because of the origin of your renal tubular epithelial cell. Okay? So, from the name itself of the epithelial cell, sabi niya dyan, renal tubular. So, galing po siya sa tubules ng ating nephron. So, kidney in origin siya. Renal in origin na po siya. Okay? And this may indicate the presence of renal tubular epithelial cells may indicate tissue destruction. Okay, so maaaring nagkakaroon na ng damage yung kidneys natin kaya nakikita na natin si renal tubular epithelial cells. Okay, so least frequently seen but it is the most significant. Okay, so I hope maalala po natin ang mga sinabi ko kanina. Alright, so yan. Punta na tayo sa bawat epithelial cells. How do they look like under the microscope? Okay? So of course, first, bakit ayaw niya mag-next? Ayan. Sige, tanggalin ko lang ha. Ayan po. Alright, so yan. So we have your epithelial cells. Okay, so take note that your squamous epithelial cells, they are considered to be the largest sediment, okay, that is found in your urine. Okay, so largest cell in urine sediment. If you are going to look at how your squamous epithelial cells okay, appear under the microscope, so you can see there an irregular cytoplasm. Okay, so makikita po natin yung irregular makikita po natin yung irregular cytoplasm, yung irregular borders po ng ating ng ating squamous epithelial cell. All right? And if you are going to look at some of the squamous epithelial cells under the microscope, pwedeng folded. Okay? Pwede pong folded yung kanilang cytoplasm. All right? So apart from that, take note that your squamous epithelial cell has an abundance, an abundance of cytoplasm, and you can see here the prominent centrally located nucleus. Okay, yes, so centrally located nucleus. So as for the average diameter of your epithelial cells, it is 30 to 40 micrometers. Okay, so that is the average diameter. Alright, so aside from that, okay, so saan ulit nag-originate ang ating squamous epithelial cell? Alright, very good. So magsimula ka sa baba. So we have your vaginal lining for females and of course the lower portions of your urethra for both male and female. Okay, so yan po. It is the least significant but it is the most frequently seen epithelial cell. Alright, so actually, in practice, okay, malalaman mo na you are in focus pag nakikita mo na sila epithelial cells. Okay, so yun ang pwedeng practical use ng ating epithelial cells sa microscopic analysis ng urine. Pag nakita mo si epithelial cell, kasi they are very common talaga in your urine, ibig sabihin, you are in focus. Okay, so apart from that, okay, in practice, pwede din po nating gamitin yung nucleus ng ating squamous epithelial cell in order to determine whether a particular nearby cell is an RBC or not. Because sometimes, katulad nga ng sinabi ko lagi, okay, katulad nga ng lagi kong sinasabi, medyo mahirap nga naman talagang i-identify yung mga cells natin, okay, under the microscope, particularly sa ating mga urine samples, okay? So another another practical application of your epithelial cells in urine is that we can use the nucleus of your squamous epithelial cell in order to determine whether a nearby cell is an RBC or not. Okay, so yung centrally located nucleus of your squamous epithelial cell, it has a size that is approximately the same as that of your RBC. All right, so say for example, dito po sa ating dito po sa ating PowerPoint. Okay? So ito, yan yung nucleus ng ating squamous epithelial cell. And then ito, this one is an RBC. Very obvious actually because you can see the biconcavity of your RBC. So if you are going to compare the size, okay, kung i-compare natin yung size, approximately the same po yan. Alright, so that's why pwede din po nating gamitin yung nucleus ng ating squamous epithelial cell to determine nga kung RBC or hindi yung isang karatig or yung malapit na cell sa kanya. Okay, so yan. Okay, least significant. Okay, nasabi ko na yan. Alright, so yan po, squamous epithelial cell. Alright, so yan. Ito, squamous epithelial cell yan. Ito, we have two here kasi makikita mo dalawa yung nucleus na nandyan. Okay, so two squamous epithelial cells there. Alright, so now moving on to the next type of epithelial cell. Okay, so the next type of epithelial cell, we have your transitional epithelial cell. So just like what I have mentioned, ano yung ibang names ng transitional epithelial cell natin? We have urothelial cell, caudate cell, okay, and huwag kakalimutan, do not forget, yung ginamit nila in the recently concluded board exam, bladder cell. Okay, so yan, those are the terms that we use in order to refer to your transitional epithelial cell. Okay, so again, saan nag-o-originate ang ating squamous epithelial cells? So they originate from mula sa pelvis, actually mula sa calyces natin, and then up to the upper urethra. Okay, so that portion of your urinary tract, it is lined by your transitional epithelium. Okay? Yes. So how are we going to, ito po. Okay, how are we going to describe, okay, the appearance of your transitional epithelial cell? So they are actually spherical. Okay, they are spherical with an average diameter of 12 to 20 micrometers. Saglit. I-ano ko ha? Okay, so they are usually spherical in shape with a diameter of 12 to 20 micrometers. Okay, with a diameter of 12 to 20 micrometers. Okay, so yung spherical natin, so yan usually yung kanilang diameter. Alright, so since ang ating transitional epithelial cells have the ability to change their shape. Tama? Oh, tama, di ba? Yes, tama yan. Pinag-aralan nyo yan sa histology. Kaya nga sila tinawag na transitional kasi they can change their shape. Okay? And so, hindi lang spherical ang pwedeng shape ng ating transitional epithelial cells. So, they may also appear as polyhedral. Okay, they may also appear as polyhedral. They may also appear as cylindrical. Okay, cylindrical in shape. Or they may also appear as caudate. Yung parang may buntot. Okay, so that's your caudate. Alright, so those are the possible shapes of your transitional epithelial cells. Alright, so yan. Okay, so if for example, ang nakita natin under the microscope is the spherical. Ayan, dyan tayo magkakaroon ng problema. Okay, bakit? Kasi ang ating spherical transitional epithelial cells, kamukha niya si renal tubular epithelial cells. So that's why it's important for you to be able to differentiate the two. Okay? Yes, kasi mukha talaga siyang RTE. Pero pwedeng spherical lang siya na transitional epithelial cell. Remember, saan tayo magkakatalo pag na-misidentify mo 'yan? Magkakatalo tayo sa significance. Okay? Kasi ang RTE, very significant yan. It is the most significant epithelial cell as compared to your transitional epithelial cell which are only significant pag marami sila. Okay? Doon tayo magkakatalo sa significance po. So, dapat marunong tayong mag-differentiate. Okay? So, one or the basis of differentiating your transitional epithelial cell, particularly yung spherical, to that of your renal tubular epithelial cell is you look for the location. Okay? So, ang titignan po natin ay location of the nucleus. Alright, so take note that your transitional epithelial cells, regardless of the shape actually, they have a centrally, okay, so they have a centrally located nucleus as compared to your renal tubular cells which have nucleus that are eccentrically located. Okay, so yan, ipapakita ko later on. Okay, so centrally located ha, yung nucleus po ng ating transitional epithelial cells. And again, significance, not significant in small numbers. Okay, not significant in small numbers. All right, so in the laboratory, okay, and with regard to the collection of your urine sample, dapat alam din natin kung paano na-collect yung ating urine sample. Kasi, okay, if for example, maraming transitional epithelial cells, hindi naman automatic yan na may pathologic condition yung pasyente. Malay mo, okay? Yung manner of collection ng kanyang urine sample is via catheterization. Okay? So kung kunwaring an invasive urologic procedure was performed in the patient, magkakaroon po ng increase in transitional epithelial cell. Okay? So ulitin ko lang ha. Isulat ko lang or i-type ko lang. Okay? So they are usually increased. Yes, they are usually increased in invasive, okay, in invasive urologic procedures in the laboratory, such as in the case of catheter insertion. Okay? Yes, kung kunwari naka-catheter yung ating pasyente, of course, kung magpa-perform kayo ng urinalysis, talagang increased ang kanyang transitional epithelial cells. Okay? So in particular, or in relation rather to invasive urologic procedures, your transitional epithelial cells, they would usually appear in pairs, okay, or even in clumps. Ayan. So they would usually appear in pairs or in clumps. Sorry na pwede nyo namang balikan yung video. Okay, so ganun po. Alright, so now let us move on to your, to the most significant epithelial cell. Ano ulit ang Ano ulit ang pinaka-significant na epithelial cell? Okay, very good. We have your renal tubular epithelial cell. Okay, so depending upon the specific origin of your renal tubular epithelial cell, they actually vary in size. Okay? They vary in size. So, pag RTE ang pinag-uusapan natin, okay? Yes. Those that come from your proximal convoluted tubule are actually, yes, are actually considered to be the largest. Okay? So, I repeat, as to the specific origin of your renal tubular epithelial cell, ang pinakamalaki ay yung nanggagaling sa proximal convoluted tubule, which are 20 to 60 micrometers in diameter. Okay, yes, so they may be 20 to 60 micrometers in diameter. All right. Ayan, so okay, so yan. So 20 to 60 micrometers in diameter. All right. So if you are reading the 23rd or 22nd edition of Henry, ang nakalagay po doon ay 14, tama ba ako? Ang nakalagay po, tama. Ang nakalagay po doon ay 14 to 60 micrometers. Okay? So regardless of the value, okay, what you have to remember is that cells that come from your PCT. Okay? So, yes. And actually, pati sa DCT. Ayan. So, cells coming from, RTE cells coming from your PCT and your DCT are the largest renal tubular epithelial cells. Okay? So, we have 14 to 60 or 20 to 60 micrometers. Alright? Ayan po. So, for your Alright, ayan. Sorry ha, class, nai-stop-stop. Pero hindi nyo naman halata nag-i-stop-stop ako. Okay, so anyway, ayan. So back to our RTE cells. Okay, so ayan. So 20 to 60, paulit-ulit ka naman, alam ko. Okay, 20 to 60 micrometers or 14 to 60 micrometers. Okay, so yan. So if you are reading Henry, according to Henry, yan ang possible na size ng ating RTE cells coming from your PCT and your DCT. Okay? However, some authors would say that RTE cells coming from your DCT are smaller as compared to your PCT. Pero wala naman silang binigay na value. Okay, so for example lang, maitanong siya sa exam natin, okay, the largest therefore na RTE ay nanggagaling sa PCT. Okay, yes. Kung walang both or walang all of the above, kasi syempre kay Henry, PCT at saka DCT eh. Pero sa ibang references po kasi natin, PCT lang. Okay, yung DCT are smaller as compared to your PCT. Okay, so kung wala pong both or walang all of the above, the best answer is of course your PCT. They have the largest RTE cell. Okay? Yan. So when it comes to their appearance in your urine, okay? So RTE cells coming from your PCT and your DCT usually they are usually in singles. Okay? Yes, in singles. In single. Ano ba? They appear singly na lang, okay? Or tama naman, in singles, okay? Singly or in singles, okay? Ayan. So, apart from your PCT and your distal convoluted tubule, your RTE cell may also originate from your collecting ducts, okay? So, if they originate from your collecting ducts, they usually have a size of 12 to 20 micrometers. Okay, so they usually have a size of 12 to 20 micrometers, and as compared to the appearance of RTE coming from your PCT and your DCT, which is in singles, ang ating RTE cell from your distal convoluted tubule, they usually appear in groups of 3 or more. Okay, so they usually appear in groups of 3 or more. Alright, so yan. So yan po ang kanilang basis of differentiation. Yung size, at saka syempre yung arrangement, okay, as they are observed under the microscope. Alright, so yan. In one of the books that I have read, okay, it made use of the description, large sheets of cells. Okay, so yung description na to, ginamit nila for your RTE cells, particularly those that originate from your collecting duct. Okay, so kung makita nyo yung term na yan in your exam, large sheets of cells, RTE cells po yan coming from your collecting duct. Okay, so yan. Alright, take note. Ayan, sige. Take note that in the recent board exam, sabi ko nga, ang tanong actually dun is, how do you differentiate daw your RTE cell from your bladder cell? So ngayon, kilala na natin kung sino si bladder cell. Tama? And of course, since hindi naman sila gumamit ng term, di ba, na hindi masyadong familiar sa clinical microscopy, so alam naman natin kung ano ang RTE cell. Okay? So take note class ha, that your RTE cell or your renal tubular epithelial cell and your bladder cell are differentiated based on, ano ulit ang basis? Location of the nucleus. Okay? So for your transitional or for your bladder cell, the location of the nucleus is central. Okay, it is located at the center of the cell. However, the location of the nucleus of your renal tubular epithelial cell is eccentric. Okay, location is eccentrically. Okay, it is eccentrically located. So, ano ang ibig sabihin? Sorry. Okay, sorry, hindi na siya masyadong halata. Okay, so anyway, ano ang ibig sabihin, ma'am, ng eccentrically located? Ibig pong sabihin, it is off-center. So medyo nasa gilid siya ng cell. Hindi po siya, syempre, hindi siya nasa center. Hindi siya nasa gitna ng cell. Nasa medyo gilid po siya. It is off-center. Okay, so tignan natin yung mga images na nandito sa ating PowerPoint. So like for example, this one. O yan ang nucleus niya. Nasa gitna ba siya? Hindi. Nasa off-center siya. Nasa medyo gilid siya. Okay? So I think dito sa mga cells na to, mas halata na nasa gilid siya. So say for example, itong nucleus na to ng ating RTE cell, 'di ba? Nasa gilid siya, wala siya sa gitna. So same is true with this nucleus of your RTE cell. Again, it is off-center, it is eccentrically located. Okay? Compared to the central location of the nucleus of your bladder cell or your transitional epithelial cell. Okay? Yes. Yes. So, since our renal tubular cells, are considered to be the most significant, ano ang significant number ng renal tubular cells natin? Okay? So, take note, ha? Take note that the presence of 2, okay, RTE per high power field is already considered as significant. Okay? Yan. So the presence of more than 2 RTE cell per HPF, this is considered to be significant. Okay? And it is associated with what? Yes, with what condition? So it is associated with with necrosis. Okay, ko lang. Okay, it is associated with necrosis or injury, okay, of the renal tubules. Ayan. So it is associated with Sorry. It is associated with necrosis or injury of your renal tubules. Okay? So, ibig sabihin, nasisira na yung renal tubules ng ating nephron. Okay? So, necrosis or injury of your renal tubules, this indicates tissue destruction of your kidneys or in your kidneys. Okay? Ayan. So, in particular, yes, necrosis or injury of your renal tubules, this is seen in, of course, your tubular necrosis and your renal graft rejection. Okay, so apart from that, yes, apart from that, it may also indicate other conditions, okay? Other conditions such as your acute glomerulonephritis, okay? Yan. So we have your renal tubular epithelial cells. It may also indicate nephrosis, okay? It may also indicate hemolytic anemia, okay? Hemolytic anemia. Yes, and hemochromatosis, okay? As long as there is an injury to your tubules, to your renal tubules, you would be able to see your renal tubular epithelial cells, okay? So yan. All right. All right. So I hope, yes, you were able to understand that. Okay, so when it comes to our epithelial cells, meron pong mga variations. Okay, there are modified, kumbaga. So may I use the word modified. Okay, there are modified forms of your epithelial cells which may be present in your urine sample. So what are these modified versions? Okay, modified versions of our epithelial cells. So we have your clue cells, we have your oval fat bodies, okay, we have your bubble cells. All right, so una, dapat alam natin what type of epithelial cell is involved in the formation of these various modified sediments. Okay? So first, we have your clue cells. Okay? Ayan. So take note, class, na pag sinabi nating clue cells, it's actually a squamous epithelial cell. Okay, it is a squamous epithelial cell that is studded. Studded. Okay, it is a squamous epithelial cell that is studded or that contains Gardnerella vaginalis. Okay, so Gardnerella vaginalis, this is the causative agent of your bacterial vaginosis. Ayan. Ma'am, bakit naman squamous epithelial cell lang? Tignan mo yung sakit na involved. Vaginosis. Sa may vagina yan. 'Di ba? O, meron bang transitional epithelial cell sa vagina? Wala. Okay? Meron bang renal tubular epithelial cell sa vagina? Wala. Kasi, ang epithelial cell na nandun ay squamous lang. Kaya nga 'di ba, diniscuss ko yung origin ng ating mga epithelial cells. Okay? Para mas maintindihan natin, para ma-correlate natin, okay, yung kanilang mga variations or modifications. Alright? Nakuha? Bacterial vaginosis yan, class, 'di ba? Nasa vagina. Vagina ang pinag-uusapan natin dito. Okay? And so, anong epithelial cell ang nasa vagina? Squamous epithelial cell. Okay? Ayan. So, kung squamous epithelial cell ang nandun, anong epithelial cell ang malalagyan ng Gardnerella vaginalis? Siyempre si squamous lang, okay? Hindi naman magta-travel ang Gardnerella vaginalis pataas, 'di ba? Hindi naman siya pupunta doon sa taas kasi nga bacterial vaginosis 'yan. Okay? And so, squamous epithelial cell lang po. Okay? So, yan. Alright? So, squamous epithelial cells. Alright? So, another, we have your oval fat bodies. Okay? Your oval fat bodies, so these are highly refractile renal tubular epithelial cells, okay, that contains lipids. Okay, so yes, lipids na naman. Lipids. Take note, pag sinabi nating lipiduria, dalawang lipids ang pwedeng present. It's either your cholesterol or your sorry, it's either your cholesterol or your neutral fats, otherwise referred to as your triglycerides. Tama? Okay. Ayan. So ang ating oval fat bodies, renal tubular cells naman siya. Okay? Kasi ganito class, okay? Pag nagkaroon ka ng droplets ng fats, if fats are being excreted out, okay? If fats are being excreted out in your urine or as part of your urine, okay? Anong cells ba yung nandoon sa taas? 'Di ba? Anong cells ang nandoon sa pinakataas, yung dadaanan, yung unang dadaanan ng ating filtrate? We have your renal tubular epithelial cells. May squamous ba doon? Wala. May transitional ba doon? Wala. And so, anong epithelial cell yung makakasalamuha nung na-excrete, okay? Or yung dumaan, okay? Dumaan sa ating filtration. Ang makakasalamuhan niya ay si renal tubular epithelial cells. Okay? So this tubular epithelial cells will then imbibe these different lipids or fats which are excreted out as part of the filtrate. Thus, you will have your oval fat bodies. Okay, so since pinag-uusapan na naman natin ang lipids, actually class, medyo paulit-ulit lang ito. Tama? Ayan, ano yung pwede nating gamitin in order for us to determine whether yung renal tubular cell natin ay merong lipids. Okay, very good sa mga nakaisip. So we have your polarizing microscope. Diba? Kasi lipids ang pinag-uusapan natin dito, class. Okay? So, kung polarizing microscope ang gagamitin mo, ano ang ina-after natin? We are after we are after the formation or the observation of your maltese cross formation. Class, dito ko na lang ilagay sa gilid, Okay. Yan. Ayan. So, oval fat bodies. Sige. Oval fat bodies. Ayan. So, again, in order for us to determine na talagang lipids ang nasa loob ng renal tubular epithelial cells natin at pwede natin siyang tawagin na oval fat bodies, you can make use of your polarizing microscope. We are after the observation of your maltese cross. Paulit-ulit. Ito na naman yung sinabi ko kanina. We have the observation of your maltese cross formation. And again, pag merong maltese cross formation, anong lipid ang meron doon sa RTE cell natin? Yes, very good. We have sorry. Yes, very good. We have your cholesterol. Okay? So since lipids ang pinag-uusapan natin, syempre hindi natin pwedeng ipagwalang bahala. Ipagwalang bahala ang ating lipid stains. Okay? So ano yung mga lipid stains natin? We have your Sudan 3, 'di ba? Or your oil red O. Okay, so meron tayong Sudan 3 or your oil red O. So again, ano ang positive natin for our Sudan 3 or our oil red O? We have your orange red color. And what lipid is detected by your Sudan 3 or your oil red O? We have your triglycerides or otherwise referred to as your neutral fats. Ayan. So yan ang pwede nating gamitin na techniques. Okay, when it comes to your oval fat bodies, yes, oval fat bodies. Okay, so yan po. And then, we also have a type of renal tubular epithelial cell that contains non-lipid filled vacuoles. Okay? So yan. So pag sinabi mong bubble cells, renal tubular epithelial cell lang din yan. Walang transitional na bubble cell, walang squamous na bubble cell. Oval fat bodies, renal tubular epithelial cell lang din yan. Walang transitional na oval fat body, walang squamous na oval fat body. Okay? So yung bubble cells natin, alright, so of course, if you are going to subject it to polarizing microscopy, it's negative for your Maltese cross formation. And of course, again, if you are going to subject it to our lipid stains, it will also be negative for the orange-red color that we are after. Okay? So it's important that we are able to clearly differentiate your oval fat bodies from your bubble cells. So pag positive, polarizing, may Maltese-cross formation, positive orange-red sa ating lipid stains, oval fat bodies yan. So pag negative in both, bubble cells yan. Kasi non-lipid. Okay? Yung vacuoles niya. Nakuha? Ayan. So those are, yes, the modifications of your epithelial cells which might be present in your which might be present in our urine sample. Okay, so how do they look like under the microscope? So first, we have our clue cells. O, di ba? Yan, studded with Gardnerella vaginalis. And as you can see here, dito sa ating PowerPoint, okay, makikita mo talaga along with your clue cells, there are a lot of neutrophils. Oh, ang daming neutrophils. 'Di ba? Ayan. So indicative that there is a bacterial infection happening in the vagina of our patient. Okay? So yan, makikita mo yan. All right? So another, we have here naman your oval fat bodies. Okay. At saka ganito class, share ko lang. Okay? SKL. Share ko lang, SKL. Whenever we are given yung result ng urinalysis and then may nakita ka doon sa microscopic examination, nakita mo oval fat bodies, automatic nephrotic yan. Okay, automatic po nephrotic syndrome yan. It is a nephrotic type of renal disease. Okay, kasi saan ba nagkakaroon ng lipiduria? 'Di ba? Pag nephrotic syndrome. Okay, pag nephrotic yung disease natin. Okay, kaya wag ka nang mag-isip. Pag nakita mo yung oval fat bodies, automatic nephrotic syndrome yan. Promise. Okay, promise. Alright, so yan. This is your oval fat body. Okay, so yan po siya under our bright field microscope. Okay, so again, if you are not sure whether it is an oval fat body or a bubble cell, you have to view it under your polarizing microscope. Okay, so actually, wag ito. Kasi ano yan fatty cast yan actually. Okay, so ito siya. Ayan. So as you can see there, you have there yung ating tinatawag na Maltese cross formation. So we are sure that this RTE cell is an oval fat body because it contains cholesterol. So lipids yang mga yan. Okay, lipids yung nasa loob ng ating RTE cell. Okay, so yan po. Alright, so for our oval fat bodies, okay, so seen in lipiduria. Yes. All right, and it is usually associated with nephrotic syndrome. All right, so this one naman is your bubble cell. Okay, bubble cell. Yeah, the difference is that makikita mo yung delineated na vacuoles doon sa loob. Okay, as compared pag lipids ang nasa loob, 'di ba? Hindi mo makikita yung vacuole. Hindi mo makikita na vacuolated siya. But in your bubble cell, you would be able to see yung vacuoles niya. Okay, yan. May mga vacuoles siya. Okay, and if you view this under your polarizing microscope, it will not have Maltese cross formation. It will not have an orange-red color in your lipid stains. Okay, indicating that it does not contain any lipid. Okay, yes. So we have here your bubble cell. Okay? So yan. So now let us move on to the other miscellaneous structures. Bali, inuna ko na yan. Okay? And then, ihuhuli na lang natin. Na lang po natin yung ating casts and crystals. Kasi medyo madami-dami sila. Okay, so yan. So mucus threads po muna tayo. Alright? So your mucus threads, they are actually produced by the glands, okay, that line your urinary tract, as well as the epithelial cells also of your genitourinary tract. Okay, so yan. They may also be produced by your renal tubular epithelial cells in your nephron. Okay, so okay, ayan. In practice po, most frequently present, theoretically, ang sinasabi ng mga libro natin, it is more frequently present in female urine samples. Okay, however, in practice, mas nakikita siya sa males. Ayan, sorry. Yan usually yung pinag-uusapan din namin in the laboratory, okay? So, pag kunwaring turbid, tinitignan namin yan. Tinitignan namin kung male or female yung yung ating patient. Yan. Pag in practice ang pinag-uusapan natin. In practice, pag epithelial cell, mas nagko-cause yan ng turbidity among our female patients. Okay? So pag female yung patient natin, turbid yung urine sample niya, expect ang dami niyang squamous epithelial cell. Okay? So pag kunwari naman turbid yung urine sample from a male patient, expect naman a lot of mucus threads. That is in practice. Pero ang sinasabi sa atin sa mga libro, more frequently seen daw ang mucus threads sa female. Okay? Ayan. So paano na yan sa exam? Okay, paano na yan sa exam? So of course, you also have to consider yung other results niya. Okay? Yung other parameters. Ayan. Alright. So, yan po. Okay. So, yan. So, your mucus threads. Okay. So, next na natin. Ayan. Okay. So your mucus threads, okay, so they have a spider web-like appearance under the microscope, and the constituent that is present. Ayan, nasa ano nyo kasi nasa module nyo. The constituent that is present in your mucus thread is your thumb horsefall protein. Okay, so we have your thumb horse protein. Alright, so yan. So that is the constituent that is present. Bakit small? Okay, capital yan ha. That is the constituent that is present in our mucus threads. We have your thumb horsefall protein. So take note that your thumb horsefall protein, this is otherwise referred to as your uromodulin. Okay, otherwise referred to as your uromodulin. So, under the microscope, actually, you are very lucky pag ganito ang nakita mo. Diba? You're very lucky pag ganyan ang nakita mo. Kasi, sabi ko nga, your mucus threads, they have low refractive indices. So they have almost similar refractive index as that of your urine sample. So that's why medyo mahirap siyang hanapin or medyo mahirap siyang makita under the microscope. So actually, dito naman sa image na to, nagkataon lang na maraming mucus threads yung pasyente, kaya medyo madali siyang ma-identify. Okay? But yes, isa siya sa mga pinakamahirap na i-identify na sediment under your microscope. Okay, so yan. So if, for example, your mucus threads appear in clumps, so they may be mistaken as your hyaline casts. Okay, so they may be mistaken as your hyaline casts. So as for the significance of your mucus threads, so in general, it is not significant. However, the number of your mucus threads may be increased if there is irritation. Okay, if there is irritation. Okay, so increased in irritation of your genitourinary tract. Okay, so we have your mucus threads. All right, so another, we have your bacteria. Okay, so your bacteria class, Yes, your bacteria, this is significant in the case of your urinary tract infection. Okay, saglit lang class ha, may titignan lang ako. Alam po, inano ko po. Okay, wala. Alright, so they are significant for your urinary tract infection. Yes, and the presence of bacteria, it should be confirmed with a positive urine culture. Okay, yes. So take note, class. Yes, take note, class, na ang bacteria natin or ang urine sample natin pala, okay, it is sterile. Okay, it is a sterile, okay, it is normally sterile. It is a normally sterile body fluid. So that means nagkakaroon lang po siya ng bacteria if, for example, the patient is suffering from urinary tract infection, or if, for example, the urine was contaminated. Okay, so the problem with our body is that meron tayong tinatawag na normal flora. And so there are a lot of sources of contamination. Okay, yes. So contamination may be brought about by normal flora which are present in the vagina, which are present in the urethra, or which are present in the external genitalia of our patients. That's why, di ba, bago mag-collect yung pasyente, sinasabi natin, ma'am, punasan yung external genitalia or mag-wash ng external genitalia. Kasi sabi ko nga, ang urine normally dapat sterile yan. Unless nagkaroon ng contamination from the different areas na merong normal flora or merong UTI yung pasyente natin. Okay? So yan po. Alright. So how would you know? Wait lang. Okay, how would you know na significant yung bacteria natin? Kasi sabi ko nga, ang daming sources, possible sources ng contamination. Paano mo malalaman? Paano mo malalaman na significant ang ating bacteria? Significant po ang ating bacteria pag present siya with your WBC. Okay, yan. Masasabi mo lang na UTI siya pag meron ka ding nakitang WBC. Doon mo lang masasabi na UTI, may UTI yung pasyente at hindi lang contamination yung bacteria na nakita natin. Okay, ayan. So it can indicate lower or upper UTI. Okay? So ayan. Alright. So under the microscope, sabi ko nga, yan ang pinaka-favorite ko na sediment kasi talagang gumagalaw sila, okay? Which is very cute under the microscope, okay? So parang ito, class. So as you can see, ang dami niyang bacilli, 'di ba? Ang dami po niyang bacilli, okay? And along with your bacilli are, of course, yung ating mga neutrophils, okay? Yung ating mga WBCs. O, di ba ang dami? O, mga bacilli. O, yan, yung mga ganyan, yung mga rod-shaped na sediments dyan, mga bacilli yung mga yan. At, grabe, ang cute nila under the microscope kasi gumagalaw sila, nagtatumbling-tumbling sila, ganyan. Okay, so yan. So, ito, masasabi natin na may UTI yung pasyente. Hindi lang dahil sa na-contaminate ng normal flora yung ating urine sample. Okay? Alright. Okay, yes, konti na lang. Hindi, I mean, konti na lang for this video. Okay, so another, we have your yeast cell. So these cells contain doubly refractile walls. So they usually appear as small refractile oval cells. Yes, some with mycelial form. So merong mycelium yung iba, may hyphae yung iba. But usually, they appear as budding, Oo, makikita mo yung budding ng ating mga yeast cells and that would indicate na hindi siya RBC kundi yeast cells siya. Okay, so marirealize nyo yan pag pinakita ko yung next na slide. Alright, so take note that your yeast cells, they are insoluble in acid and alkali. So that's why in order to differentiate your yeast cells from your RBCs, which are commonly mistaken as the same sediment, so you can make use of your acetic acid. So your yeast cells, they are insoluble in acetic acid as compared to your RBCs, which are soluble in your acetic acid. So the most common yeast cell that is observable in your urine sample is your Candida albicans. So take note ha, especially for females, diba? We have a normal flora. Ang Candida albicans po, that's part of the normal flora of the female vagina. Okay, malamang. Okay, may male vagina ba, ma'am? Hindi ko alam. Okay, ayan. So, normally part po yan ng ating, part po yan ng ating normal flora. Okay, our vaginal normal flora. We have your Candida albicans. So what is the clinical significance of your yeast cells? Particularly, if we consider kasi your Candida albicans, take note that it is an opportunistic pathogen. Okay, so that means if there is something wrong with the immune system of the patient, so this can result to an infection, okay, an opportunistic infection for that matter. So clinical significance of your yeast cells, so they may be seen in patients who are suffering from diabetes mellitus. Vaginal moniliasis is the same as candidiasis. Vaginal moniliasis is the same as candidiasis. I think you are more familiar with the term candidiasis. And of course, in immunocompromised patients. So just like what I have mentioned, your Candida albicans, it is an opportunistic pathogen, okay? And so makikita din natin siya sa immunocompromised patients or immunodepressed patients. Okay? So under the microscope, so if the mycelial forms or if the hyphae are present, so very easy naman to identify. If the budding, di ba? Like for example, ito, may mga budding po siya. If the budding of your yeast cells is demonstrable, so of course, it will be easier for us to identify them as your yeast cells. Ito, yeast cell ba yan? Hindi. Magkatabi lang po yan na RBC. So makikita mo yung kanyang biconcavity. O, di ba? Mukha nga naman talaga siyang yeast cell. Okay? Pero actually, RBC yan. Alright? So, yan. Itong mga to. Okay? So, those are your yeast cells. Alright? So, yan. So, malapit na po tayo. Last na. Ay, hindi pa. Dalawa pa. Parasites and then sperm cells. Okay? So, next sediment, we have your parasites. Alright. Ito din, class. Paborito din nila ito sa board exam. Okay, so there are basically 3 parasites which we may be able to see in your urine sample. We have your Trichomonas Vaginalis, Schistosoma hematobium, and your Enterobius vermicularis. I know! Yeah, right! You're taking your parasitology subject. Yes, napakaganda ng parasitology. Especially sana kung nag-face-to-face tayo, sayang. Okay? Kasi ang gaganda nila. Kahit mga parasites yung mga yan, ang gaganda po nila under the microscope. Yes, very beautiful po sila under the microscope. Yung mga eggs ng ating mga parasite, naku, napakagaganda nila under the microscope kahit na parasite sila. Okay, may ganda po silang tinatago. Ayan, sayang hindi tayo face-to-face, but I'm sure sa internship ninyo, face-to-face tayo. So, oh my gosh, I'm super excited. Yay! Mag-application na kayo. Yes, magpa-practical skills. Yes, yes, yes. Okay. Ayan. Hindi pa kayo excited? Kasi ako super excited. Okay. I'm so excited to see you guys. Alright. So anyway, tama na yan. Okay. Anyway, wait, taba ng leeg ko. Ayan. Anyway, ayan, Trichomonas vaginalis. Okay, so Trichomonas vaginalis class, this is the most frequent parasite. Okay, lagay lang natin, most frequent parasite that is seen in our urine. Bakit? Kasi, balik punta tayo sa parasitology nyo punta tayo sa parasitology nyo. Anong sample ba ang ginagamit sa demonstration ng Trichomonas vaginalis? Perfect! We have, ang ginagamit po dyan ay urine at saka vaginal secretions. Hindi tayo gumagamit ng poop. We do not make use of your feces or of your stool sample to determine the presence of your Trichomonas vaginalis. Okay? Ang ginagamit po dyan ay urine or vaginal secretion. Kasi tignan mo naman yung scientific name niya, Bes. Trichomonas vaginalis. Vagina. Okay? So, ibig sabihin, yung parasite natin ay nasa vagina. Kaya, bakit ka gagamit ng poop? 'Di ba? Bakit ka gagamit na, ay, ba't ka galit, ma'am? Hindi ako galit. Okay? 'Di ba? Kaya hindi tayo gagamit ng feces, hindi tayo gagamit ng stool kasi nasa vagina yung parasite. So ano bang sample ang dumadaan sa vagina? Okay, very good. Urine. Ano pa? Vaginal secretions. Naku ha, favorite nila ito, class. Sinasabi ko sa inyo. Favorite nila ito sa board exam. Okay? Yan. So your Trichomonas vaginalis, it is the most frequently seen parasite in urine and it is associated with your ping pong. Okay? It is associated with your ping pong disease. Okay? And, ito na. Serious na ito. Okay? And, take note that your Trichomonas vaginalis, it is only reported. Lagay ko nga dito para hindi nyo makalimutan. Reported. Wrong spelling pa. Reported only, okay, when, caps lock para intense, moving. Okay, it is only reported when moving. Okay, and so, in order to take note of the presence of your Trichomonas vaginalis, ano ang tinitignan natin? We are looking at the tail movements of your parasites. Okay? Ma'am, bakit kailangan gumagalaw? Bakit kailangang tignan ang tail movement or yung flagella movement ng Trichomonas vaginalis? This is because, may ganun this is because your Trichomonas vaginalis in urine will resemble several sediments. So in urine, your Trichomonas vaginalis resembles your WBC, okay? It resembles your transitional, okay? And your renal tubular epithelial cells. Oh, yun naman pala. Okay? Kaya pala, ganyan ko class Ayan. Kaya pala, nire-report lang natin siya pag gumalaw or pag gumagalaw kasi it resembles several sediments. Malay mo, 'di ba? Hindi naman talaga Trichomonas vaginalis yung nakita mo. Ang nakita mo pala ay, okay, ang ating WBC. Okay? Malay mo, hindi naman talaga Trichomonas yung nakita mo, transitional lang or RTE cell. Nakuha? So that's why you have to report only when it is moving or motile. Okay? And we are looking at the tail movement or the movement of the flagella or flagellum of your Trichomonas vaginalis. Okay? So, ano yung sinabi ko kanina na isa pang sample for our Trichomonas vaginalis, we have your vaginal secretions. Okay? So, in your vaginal secretions, it resembles naman, okay, it resembles naman your WBC only. Oh, ma'am, bakit WBC lang sa vaginal secretion? May transitional ba doon sa vaginal secretion? Wala. 'Di ba? Ang transitional galing lang yan sa urinary system. May RTE cell ba sa vaginal secretion? Wala. Okay? Ang RTE cell galing lang yan sa kidneys. Nakuha? Ayan. So, yan. Alright? So, we have your Trichomonas vaginalis, most frequently seen parasite, reported only when it is moving. Okay? Yan. So, another parasite that we can see under the microscope in your urine sample is your Schistosoma hematobium. Okay? So, we have your Schistosoma hematobium. And take note that your schistosoma hematobium, yes, particularly yung eggs po ang pinag-uusapan natin. Okay? Yung eggs ng schistosoma hematobium, okay? So it can lacerate. Yes, the egg. Egg. Okay? It can lacerate the urinary bladder. Blooded. Okay, lacerate the urinary bladder wall. Okay, so yung linings ng urinary bladder natin, it may be lacerated by your schistosoma hematobium. So again, parasitology. Bakit kayo? Okay, bakit kaya pwede niyang ilacerate yung bladder? Oh, perfect. Okay, yes. So para sa mga gustong-gusto ng parasitology dyan, take note, 'di ba? Meron siyang spine. Tama? Yung ating mga schistosome eggs, they contain spines, they contain knobs, okay? So, for our schistosoma hematobium, ano ang meron siya? Meron po siyang, yes, terminal spine. Oh, ba't ka galit? Hindi ako galit. Okay? Meron siyang terminal spine, class. Tama ba ako? Okay? So, yan. Okay, ayan. Yan. So, meron siyang terminal spine. 'Di ba? Sa parasitology, ang ginagamit nga natin na term in order to describe the terminal spine of your schistosoma hematobium is, it is conspicuous. Okay, conspicuous, class, ibig sabihin malaki yung kanyang terminal spine. Okay, so since it contains a terminal spine and this terminal spine is conspicuous, it has the ability to lacerate the bladder. So that's why if you see a schistosoma hematobium egg in your urine sample, you always have to look for red blood cells. Okay? Kasi kung merong schistosoma hematobium, okay, meron ding hematuria. Okay, so yan. Yan yung isang sediment na hanapin mo. Kung kunwari hindi ka masyadong sure, no? Hindi ka kasi nag-aral ng parasitology. Ayan, nakalimutan mo. Ano na nga ba ulit ang itsura ng schistosoma hematobium? You forgot. Okay? So, tingnan mo, may hematuria ba? Kasi, kung may hematuria, okay, at nakakita ka ng parang egg, okay, parang itlog ng schistosoma hematobium, malamang schistosoma hematobium nga yan. Okay, so schistosoma hematobium, lateral, conspicuous lateral terminal spine plus hematuria, we have schistosoma hematobium. Okay, ayan po, ayan. So another, and the last one, we have your Enterobius vermicularis. Okay, so yung ating Enterobius vermicularis, unfortunately, wala naman talaga dapat yan sa urine. Tama? Yes. O, balikan na naman natin ang alam ninyo sa parasitology. Okay, so your Enterobius vermicularis in relation to clinical microscopy, it is the most common fecal contaminant. Okay, so it is the most common fecal contaminant. Diba, ano ang itsura ng Enterobius vermicularis? Diba mukha siyang letter D? Okay, it has a flat side. It has ano ba yan? One side is flat and then the other one is convex. Tama ba ako? Convex ba ang tawag dyan? Okay, so anyway, ganyan. Basta ganyan ang itsura ng Enterobius vermicularis, egg. Okay? Bakit siya tinatawag na most common fecal contaminant? Kasi, balikan na naman natin ang inyong parasitology. Saan naglilay ng eggs ang Enterobius vermicularis na female? Saan? Nag-perfect. Nag-perfect ka, Day. Okay, ang perfect. Okay, we have your perianal region doon sa butas ng puwet mo. Diyan pupunta si female Enterobius vermicularis para mag-lay ng eggs. Di ba? 'Di ba? Kaya nga 'di ba? O sige, punta tayo sa kasi na-miss ko ang para eh. Okay, so punta tayo sa para, 'di ba? Kaya nga sa parasitology, ano ang sample for the detection of your Enterobius vermicularis? Scotch tape, 'di ba? Scotch tape. Okay, your Scotch tape method. So, kukuha ka ng, syempre may Scotch tape doon sa ating laboratory. Okay? So, ilalagay doon sa may butas ng puwet mo yan. Ayan, ilalagay dyan para makolek yung eggs doon sa butas ng puwet mo, doon sa perianal region. Okay? And then take note, 'di ba? One of the distinguishing clinical manifestations of your Enterobius vermicularis infection is, yes, very good, pruritus ani or pruritus anay. Okay, tama? Ibig sabihin, nangangate. Oh, nangangate yung butas ng puwet mo kasi diyan nagle-lay ng eggs yung female na Enterobius vermicularis. Oh, I miss parasitology. Okay, tama. Ayan. So kung nandoon lang yung Enterobius vermicularis natin, nag-collect si patient natin ng urine, tumulo doon sa region na yon, andun na yung ating Enterobius vermicularis egg. Okay? Apart from that, 'di ba kaya nga siya tinatawag na sitworm? Kasi pag upo mo, upo ka ng upo kung saan-saan, ayan, kinakalat mo na yung eggs. Kasi nandun nga lang siya sa butas ng puwet mo. Okay, syempre kung nandun siya sa butas ng puwet mo, napan ij brief mo, napan ij panty, o di ba, panty ni patient or brief ni patient, syempre masasama yan. Lalo na kung hindi nagpo-follow yung patient ng proper collection procedure. Okay. Okay, I miss parasitology. Okay, so anyway, so yun po. Okay, yan. Yan yung mga kailangan nating tandaan sa clinical microscopy. Okay, so tignan naman natin ito. Ano ba ito? Ano ba itong video na to? I think this is the video of our Trichomonas Vaginalis. O, tingnan natin sila. They're really, really very beautiful under the microscope. But of course, we don't want it 'di ba? Siyempre ayaw nating vaginosis. Ay, vaginosis tuloy. Ah, magka-infection. Okay, sorry. Magka-ping-pong disease. Ayan na sila, class. Okay, yan. Ayun, yun. Galing. O, di ba? Ayan, yan. Yung mga gumagalaw lang po, Alright, di ba? Ang cute. They're really so cute. Under the microscope. Sabi ni Sir. Okay, ayan di ba? They're really cute. Para talaga silang ping-pong, yung racket ng ping-pong. Kaya nga siya tinawag na ping-pong disease. Di ba? Ayan, galing. I miss para. Okay, so anyway, ayan po. So under naman the microscope, ito naman ang ating Enterobius vermicularis eggs. Ayan. So, yan po. Alright. This is in urine. Urine po ito. Siyempre, urine yan. Napakalinis naman kung feces yan or stool sample. Okay, so last na ito for this video. Okay, so next we have your spermatozoa. So just like what we have mentioned, it depends upon the institution if it is going to be reported or not. Okay, but if it is present in your urine sample, we just indicate the presence. Okay, so in UBCL, sabi ko nga, hindi namin nire-report pag of right age or pag hindi minor. Actually, I would have to ask Sir Ruben kung paano kung minor, 'di ba? Pero in some institutions, ganun yung patakaran nila. Pag minor, ire-report mo kasi it's a possible medical legal case. Pero pag hindi minor, wag mo nang i-report. That's a normal happening, 'di ba? Lalo naman kung of the right age naman, hindi naman minor yung patient mo. Okay? Syempre, ayan, normal lang po na may sperm. Pwedeng may sperm yung ihi. Okay? So, you just have to take note na if, for example, spermatozoa or sperm cells are present in your urine, this can cause a false positive result in your protein reagent strip. Okay? So, under the microscope, ganito ang itsura niya. Ayan, hindi ko alam kung anong ginawa ng pasyente, but ang dami niyang sperm. Ang dami niyang sperm cell sa kanyang ihi. Okay, parang hindi naman na 'to ihi, 'di ba, sa dami ng sperm cells. Okay, basta ganyan ang itsura po ng sperm cell. Nakakita na ba ako sa urine? Oo naman. Okay, so siyempre ano 'yan, normal lang naman na may sperm cell. Alright, ayan. So that ends our part 2 video for the microscopic analysis of our urine sample. So I hope na ano kayo, nasiyahan kayo. Okay, ayan. So thank you so much. Yes, kaya natin to, class. Ayan, yes, kaya natin to. Bye!